What senior do you know says, when I get old, I want to go to a nursing home? They don't. They don't want to go there. That's sort of the end of life. So it's not just that somebody gets institutionalized, it's that they lose their will to live when that happens.
Nobody really does anything there. They have activities, but most of the people are senile and they don't have any enthusiasm. They just kind of exist from day to day. Exist to wake up in the morning and maybe get dressed and maybe wander out to the next room and then just sit there all day and do nothing.
One of the most pivotal moments in my teenage years was walking into a skilled nursing facility and seeing a senior in a wheelchair screaming and 3 nurses at a nursing station playing cards. I found a program that prevents institutionalization. If somebody can no longer attend a senior center independently, they've been going, they play bingo, they attend computer classes, they have nutrition at lunch, hang out with their friends, and then they start getting confused because they've got dementia and they can no longer follow bingo. The senior center says, I can't serve you anymore. The caregiver's working, she's got kids that are in school, and she can't stay home to take care of mom, so what does she do? She has to place her. Adult day healthcare is really a level beyond what a social day program is. It acts as a stopgap measure to prevent institutionalization. Everybody who comes gets a full multidisciplinary team assessment, and that means that a social worker goes to their home, evaluates the situation that they're living in. So what's their medication management? What are their barriers in the home that could cause falls? Is the caregiver not at home and do they need nutrition? So they're able to evaluate all of the possible barriers to independence, and that's the first step. Then they come into the program and they get assessed by the nurse, the physical therapist, the occupational therapist, and the activity coordinator. So each one of those persons comprises the multidisciplinary team, and we pull in a dietitian when necessary, we pull in a speech therapist when necessary, and they develop a care plan so that as that person comes to the center, they get therapies, they get interventions based on what their assessed needs were. So everybody has a plan of care that deals directly with them, with both their physical health and their mental health component. So we look at the person as an entire person, and we look at the world around them in terms of what their risk factors are for institutionalization, and we keep them from going to the institution by addressing all of those factors. In a skilled nursing facility, a person getting the basic minimum level of care is 5 times the cost of adult day health care. But if that person needs speech therapy, or if that person needs occupational therapy or physical therapy, that number goes up, up, up. So it's significantly more expensive, and it's not where people want to be. So if it doesn't have to happen, in some cases it does. That's why they're there. But in some cases it doesn't, and that's why we're here.
Они всегда приветливые. Это играет колоссальную роль, потому что в таком возрасте мы уже обидчивые становимся. А тут мы всегда видим ласковое, умное отношение к себе.
In addition to the nursing interventions that occur, we're very lucky here at our center that we have a physical therapist on staff 3 full days a week. She provides one-on-one physical therapy, she provides small group physical therapy, she works to help people maintain their balance, their gait, their ability to walk, which in turn is one of the factors that's going to help them remain living independently. The therapeutic interventions that they're getting and the instructions on how to deal with things in life that make them depressed, that make them frustrated, that make them angry, impact their physical health. And so we have just this beautiful combination of all these different factors, even for people, for example, with really brittle diabetes. The registered dietitian can provide one-on-one advice to them about their particular issues and what they should be eating and prescribe a diet for them in a setting where they have friends and they feel comfortable and they're receptive to the information, not in a sterile hospital room.
The center has been great for him. He does look forward to it every day when we come. He comes 3 days a week. I had no idea that I would get the support and the encouragement from this facility. For myself, I'm becoming a person again. I think this is the best thing that's ever happened to us at this point in our life.
The family caregivers are absolutely amazed at the difference in their loved ones' affect, in their overall mood, in their eating habits and their sleeping habits. They don't believe it until it actually happens, and then they're absolutely amazed. The family caregivers utter despair to think of what life would be like without adult day healthcare once they find it. One of our participants' daughter-in-law said, "I'd have to quit my job to take care of her, and then what would happen to my 3 kids? So I'd quit my job, which is supporting my husband, who's independently employed, and he couldn't afford to have somebody else working for him. He'd lose his business. We'd be on food stamps and welfare, and that's what would happen because we're not going to place her. Or if we did, then we all have to live with the guilt of knowing that, and I don't know if we could do that." We're able to give them insight from our skills and our experience so that they can keep mom living at home longer.